We've got 7 million people in the United States with Alzheimer's. Unlike most other chronic diseases, it's actually been going straight up. And I think that's because there are between 30 and 200 root causes for Alzheimer's. And many of those have to do with people's lifestyles, anything from genetics to toxins to infections to hormonal issues like low thyroid, high thyroid, to not enough sleep, deep N3 sleep, to head trauma. I mean, there's so many.
I am super excited to chat with Dr. Joshua Helman, the Harvard-trained physician licensed in 14 states. He holds 2 degrees in biochemistry, bachelor's degree from Harvard and a master's degree from the University of Cambridge, UK. His medical degree is from Harvard Medical School and MIT. We're going to be talking about dementia, Alzheimer's, tying it into thyroid health.
The thyroid hormone is important for every organ in the body, including the brain. So if for some reason you have a very low thyroid level or a very high one, unfortunately, metabolically, the cells aren't going to be acting well. And if we're talking about the brain cells are normally metabolically very active. If they don't have the thyroid hormone they need in the right range, there can be problems.
How do you know if someone has just poor memory and just forgetting things? How do you come up with a diagnosis of dementia or Alzheimer's?
So what I would say is,
so definitely want to get a little bit more into your background as far as why you started focusing on dementia and Alzheimer's.
sure, that's easy. When I was a teenager, my grandmother, Eileen, got Alzheimer's, and I saw how it was devastating, not just for her, but for my parents' generation, because now they're thinking, wait, this is Grandma Eileen today. What's going to happen to us in 20 or 30 years? So that left an imprint on me as a teenager. And I was a nerdy teenager who was interested in studying biochemistry. And what's actually really good is the basic fundamentals I started learning as a teenager, most of those have not changed. And so I can actually go back to that core of knowledge and apply it to a complicated disease process like Alzheimer's.
All right, awesome. Yeah, my grandmother dealt with dementia, and my aunt currently is dealing with Alzheimer's. I mean, it's definitely something that affects many of us. And yeah, I mean, how common is it? And is it something that has been increasing over the years? Have you seen like a higher prevalence of dementia and Alzheimer's?
Yeah, so unfortunately, unlike most other chronic diseases, it's actually been going straight up, the amount of Alzheimer's. And I think that's because there are between 30 and 200 root causes for Alzheimer's. And many of those have to do with people's lifestyles, and people just are not metabolically healthy like they were 40 years ago.
Did you say up to 200 causes?
Yes, between 30 and 200 root causes, anything from genetics to toxins to infections to hormonal issues like low thyroid, high thyroid, to not enough sleep, deep N3 sleep, to head trauma. I mean, there's so many. And the reality is that in most cases, it's not just one thing, which is why it's been so challenging to come up with a cure if you're going, or a treatment, if you're going to restrict it like this one treatment or medicine is going to fix everyone with such a diverse, heterogeneous disease process.
Yeah, I imagine it's complex. I mean, similar with what I work with Graves and Hashimoto's patients and even non-autoimmune thyroid conditions, but especially the autoimmune patients, there's usually not one trigger, one cause. It's multifactorial. So it's so it's complex on my side as well. So what's the difference between dementia and Alzheimer's? Is like Alzheimer's just more an advanced case of dementia, or?
Yeah, so actually, what I would say is dementia is a larger umbrella, and then within dementia, you've got some cases of Alzheimer's. Actually, in the United States, about 75% of adults with dementia, it turns out to be Alzheimer's. So when I'm speaking to the general public, I often use the terms interchangeably, but they're not. So to be specific, if you get a stroke or major head trauma or cancer that spreads to the brain, all those things can cause dementia, but they're not Alzheimer's. Yeah, so that's the distinction. And unfortunately, Alzheimer's is, the numbers are growing. We've got 7 million people in the United States with Alzheimer's. The good news is that there's hope. And that's frankly why, I'm glad to be on this podcast with you, Dr. Eric, because there is hope. And And unfortunately, most physicians and the general public don't understand that there are specific things that you can do to prevent and reverse Alzheimer's at any stage.
Oh, so okay, I'm glad you mentioned that. So even if someone has had it for many years and it's advanced, it's possible to reverse it?
It is. It's just going to take longer, be more difficult because you're trying to regenerate a lot more as opposed to with prevention, it's a much earlier in the process. But
Yeah.
the key information is that there's hope. And it really upsets me when I hear people who've gone to their doctor and said, I'll try you on this drug, but there's really not much we can do.
Yeah, it's similar with what again, Hashimoto's. Most cases, they go to an endocrinologist. They're just told to take thyroid hormone replacement, and not to say there's not a time and place for that, but that's
Right.
the only treatment. Just take thyroid hormone, even though it's an immune system condition, not a thyroid condition. So, and same thing with Graves. Graves, it's either anti-thyroid medication, radioactive iodine, thyroid surgery. Absolutely nothing is done for the immune system. And similar, like as you mentioned, for Alzheimer's, dementia, they don't do anything for the cause, just, I guess, manage a person's symptoms. And yeah, thankfully, there's practitioners like you who actually look into the root causes. And so there's up to, you said, 30 to 200 root causes. The foundations, I know you mentioned sleep as being one of them. So, and then
Actually, not only is it one, it's actually the number one. When we analyze thousands of different patients, the number one biggest risk factor for developing Alzheimer's is not enough of this deep N3 sleep.
oh wow. So just focusing on sleep will help to prevent Alzheimer's from developing. And then obviously if someone already is dealing with Alzheimer's, then I guess you try to do everything you can to help them with sleep, which must be a challenge because what's the average age of like someone with Alzheimer's? I imagine like in the 70s and 80s, which and the sleep
Right,
is going to
right.
decline with age to
But
begin
the
with,
scary
right?
thing, the scary thing is we're seeing it at younger and younger ages now.
Oh wow, what's the youngest patient you've seen with let's say Alzheimer's?
Yeah, I saw a woman in her 40s. It was a genetic case, but even the non-genetic cases, I'm seeing starting at the age of 50.
And how do you know? Like if someone has just like poor memory and just forgetting things, like how do you come up with a diagnosis of dementia, and or Alzheimer's?
Yeah, it's really cool because unlike when I went to Harvard Med School, 30, 40 years ago, because at that time, the only way to diagnose Alzheimer's was actually at autopsy. You had to wait till the person died, and then at autopsy, you would harvest the brain and actually look at some of the cells and see the Alzheimer's changes. But today, we have all these different technologies. There are different types of PET scans, imaging tests that can tell you. There are blood tests that can look at amyloid and tau. And yeah, I would say that those are the two that have revolutionized. But to be clear, if there's someone listening to this now and they have for themselves or a loved one or a friend, they're noticing their brain isn't right, one of the first things I would do is just get an imaging test of the brain because hey, you want to rule out that this isn't from a stroke or a bleed or cancer or something like that.
Yeah, makes sense. Of course, I have to put you on the spot and ask about thyroid because low thyroid hormone can also affect cognition. And when before inviting you, when we were talking about this, I'm pretty sure you said that you run a thyroid panel on everybody.
100%. And yeah, exactly right. Because the thyroid hormone is important for every organ in the body, including the brain. So if for some reason you have a very low thyroid level or a very high one, unfortunately, metabolically, the cells aren't going to be acting well. And if we're talking about the brain cells are normally metabolically very active. If they don't have the thyroid hormone they need in the right range, there can be problems.
Yeah, makes sense. So whether you have low thyroid hormone or elevated thyroid hormone, again, hypo is definitely more common than hyper, but a lot of people
True.
also have hyper too. But either way, you want the thyroid hormones to be in balance. Yeah, definitely glad you brought that we discussed this since most of the listeners have a thyroid or autoimmune thyroid condition. How about inflammation? Could just overall inflammation, is that one of the up to 200 root causes or?
Definitely. But I would say that the inflammation is almost like a super umbrella because many of the things I mentioned will cause inflammation, whether it's infections, toxins, trauma, almost all these things will cause inflammation. And the really exciting thing is I've been offering an FDA-approved drug for compassionate use that turns down the amount of inflammation in the brain, and we're seeing improvement actually after just one dose.
Oh,
So,
wow.
yeah. So I would say if you had to pick one category, definitely inflammation.
And I'm sure you're familiar with this marker, quinolinic acid, like, because sometimes I'll run like an organic acids test, or even now the
Right.
Dutch test looks at that. So, and that's supposed to be a marker of, I know there's other markers too, but if you see that elevated on an organic acids test or Dutch, I mean, it doesn't automatically mean the person has dementia or Alzheimer's, but is that a risk factor then?
It is a risk factor, but what I like to do are specific tests looking at active brain damage, specifically antibodies against different neurotransmitters or receptors in the brain. So, for example, you can find antibodies against some of the dopamine receptors in the brain, and frankly, dozens of different ones. So, yeah, I mean, there are so many different tests, but what I'm normally looking for is evidence of active damage, because if you have what's called an IgM, immunoglobulin, that normally goes along with active damage in the last couple months.
Okay, so if someone has IgM compared to like IgG antibodies, just kind of like an infection, like if someone has Lyme IgM, that's like an acute infection compared to IgG is maybe not the best comparison because chronic Lyme isn't good.
Right.
Like acute Lyme actually in a way is better than chronic Lyme. But with the brain, it sounds like if you have those IgM, the immunoglobulin M, that's not a good thing then.
Correct. I mean, it just gives you information that, hold on, there's evidence that this person's immune system is attacking itself. Let's take a step back and figure out how to fix this.
Okay. And what are some of these tests? I know, is it Vibrant Wellness that has like
Yep.
the neural zoomer, and then Cyrix Labs has like a test that also looks at antibodies against the brain?
Right. I like using the Vibrant NeuroZoomer Plus, but you're right. There are other ones too.
All right. Awesome. And is this something that if you're suspecting someone has dementia, Alzheimer's, do you just automatically do it? Is that something you do on all those patients, or?
I offer it. What I find is some people want every test. Some people are like, just treat me, so it's a continuum. It's a test I like getting, but to be upfront, there's some people who are like, no, I want to limit how much I'm spending. Because, of course, unfortunately, insurance often doesn't cover these autoimmune tests.
Yeah, makes sense. How about diet? So it spoke about sleep, the importance of sleep. How important is eating a healthy anti-inflammatory diet?
It's extremely important. You basically want to stay away from processed foods that have added salt, oil, and sugar, because those highly processed foods will cause damage to your blood vessels, including the blood vessels of your brain. We know the brain is a highly vascular organ, and if you eat a meal that's high in salt, oil, and sugar, there's actually damage right after that meal that's happening to those blood vessels.
You personally, I know you follow more of is it vegan or just plant-based diet vegan? As far as, and again, I follow more of so I'm not vegan, I'm not carnivore, but I eat meat. I eat a lot of plant-based food as well. So, so I'm definitely in favor of plant-based food. So is there any research showing like the benefits of any types of certain foods like cruciferous vegetables or others in brain health? Or
There are, and specifically, if you're eating animal products that are on the top of the food chain, there's normally a lot higher levels of toxins, whether we're talking about heavy metals, plastics, pesticides. The concentration goes up as you go up the food chain. So if most of your diet is meat or milk or fish, you're getting a much higher dose of these toxins. And there's a huge benefit to decreasing inflammation if you have a high amount of fiber in your diet. And there's zero fiber in animal products. But if you're eating plants, you're getting a huge amount of fiber.
yeah, and I agree with that. That's why I'm not a huge proponent of like carnivore, at least long term. I know there's some potential benefits short term and dealing with autoimmunity. I've had others like follow and like just come to me with and saying they followed an autoimmune. I'm sorry, they followed a carnivore diet for the autoimmune condition, got great benefits. But I agree as far as also like the gut microbiome, just the long term, the impact of not having those fiber rich foods, I think is a concern with like carnivore ketogenic diet long term. So I think we're on the same page with that.
Oh yeah.
Now, one thing I do want to bring up though,
Sure.
especially being like for those who are vegans, vegetarians, like omegas are very important for brain health
Yeah.
too, especially DHA. So what do you recommend for like vegetarians, vegans, more like algae oil? Like, I mean, what sources do you recommend to get the omegas?
Sure. So I normally recommend DHA EPA source from algae.
Okay.
That's my favorite.
Okay. Stress. How important is like stress management? What impact cortisol imbalances on the brain and potentially dementia?
It's huge. And what I find normally when I'm meeting with a patient, it's normally that the story is things were going well until this stressful thing happened in my life, whether it was divorce or a death or a new job or something like that. And then all of a sudden, their brain went downhill. So yeah, there's stress kills.
Yeah.
And we're designed to be around other people and communities. And here's a funny statistic. I mean, obviously, smoking and alcohol for that matter, but smoking is not good for you. But if you are socializing while you're smoking, and that's basically the only way you socialize, the benefit of socialization outweighs the downside of smoking. Now, I'm not recommending anyone smoke,
Okay.
but I mean, that's just how we are wired to be part of a small community. And if you find someone highly stressed by themselves with no outlet, that's definitely a huge danger.
Yeah, that makes sense. What are some of your favorite stress management techniques? Is it just as simple as like deep breathing, yoga? Is there any apps that you recommend? Or
Yeah, so I like deep breathing. I like meditation. I like exercise. Exercise will often relax you. I like New Calm. New Calm has an app, and it's so that yeah that definitely helps calming. There are supplements, whether it's lavender essential oil. There are a lot of different choices, and what I would say is just try some of these and find out what works for you. Not all of them are going to work, but the ones that work, definitely do it. I mean, there's guided meditation. There's so many choices.
I tell people whatever you're willing to do. So if someone prefers doing meditation, that's great. If you want to do yoga, if you want to do yoga and meditation, like rotate. If you want to, yeah, like you mentioned, New Calm, and there's the Headspace app, there's Calm app. I mean, there's so many different options. So I agree that stress, I mean, in autoimmunity and the conditions I deal with too, it's a big factor. I know when I dealt with Graves, stress was a big factor, and it wasn't just the emotional stressors, but overtraining as well. So the physical stressors also could have a big impact. So getting back to diet, let's talk about fasting. So how can, I guess, what type of, so it's intermittent fasting, I imagine you're recommending. I'll let you take over. So what type of fasting are you recommending for brain health?
Yeah. So what I would say is wherever you are on the fasting spectrum, start there. If you've never fasted before, intermittent fasting, I think, is very reasonable. Just skip breakfast, have a limited feeding window, say from noon until 6 p.m. or whatever you can tolerate, whatever fits into your lifestyle. And then from there, the next progression might be eating only one meal a day. And then from there, I would say water fasting. Like at True North in California, we would do water fasting for up to 40 days under medical supervision. But I don't recommend people water fast up on their own, certainly not more than a few days.
Oh, wow. 40 days. What's the longest that, yeah, have you done a 40-day water fast?
No, I haven't done 40.
Okay.
I've done,
I'm
I've
just
done,
curious.
12,
Yeah.
I've done 12 days, but it was
Yeah.
amazing. You're talking about stress.
Yeah.
All my stress melted away. And I thought that I was going to be super hungry, but actually hunger normally goes away after the first 2 days. And here's another exciting thing is that after a few days, you're super ketotic because your body is now burning fat for energy supply. So people talk about a keto diet. To me, the best keto diet is just water fasting. You're going to get very high levels of ketones.
Now, and it might contradict a little bit what we mentioned before with the fibers, but this isn't like meant to be a permanent diet. Like you're doing it for a period of time for therapeutic purposes. Like if someone's doing it for 40 days, after that, then you would gradually reintroduce like the plant-based foods, or can they just right away go back to the same diet that they were on before?
No.
If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid.
Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter.
I would say the refeeding part is the most important part. You can't just go back to eating rich, fatty foods because, think about your GI tract, your stomach like a muscle, and you've let it relax for a very long time. All of a sudden you say, hey, I want you to start exercising really hard. It's like, it's not going to work. So you go low, you go slow, you start with juices and some raw fruit and, easy thing. And then you gradually introduce more complicated things to digest. And yeah, but also as a warning, obviously, if you got someone who is super skinny, doesn't have excess body fat, they are not going to be able to water fast because they don't have the fuel. What happens if you take someone like that and they water fast? They're actually going to break down muscle for fuel, and you don't want to be normally breaking down muscle. And yeah, so I would say fasting is a very powerful way to optimize your body metabolically. I will say that historically, if you go back thousands of years ago or even hundreds of years ago, most humans, most of our ancestors had time periods where there was famine. Our body biochemically is designed occasionally to not have calories. And I think that's why something called autophagy, where while you're fasting, your autophagy is just Greek for you're eating yourself. Basically, your body will recycle proteins that are deformed. And so I view fasting as a renewal state, but it's like anything else. It takes practice. If you've never fasted before, don't feel bad. Just like I said, try skipping one meal a day to start with.
Yeah. Yeah, that makes sense. So like you said, either skip breakfast or skip dinner. And yeah, it's actually not too bad when you do it that way. For those who might be listening and might be intrigued with, let's say, the water fast, and like you said, like you would recommend medical supervision, but if they're wondering, well, how about if I just want to do a juice fast for a week or 12 days or a month? I mean, does that have like close to the same benefits or not really the same benefits as a water fast?
I don't think it has quite the same, but it's still extremely beneficial. But let's just be upfront. Some of the people who started planning to do a 40-day water fast after, say, day 13, their body's like, no, I need some calories. And then we will shift them to juice for a few days and then see if we can get them back to water. So this is a dynamic process. Now, to answer your question, though, I find if you're doing a very long-term juice fast, it really depends on your medical issues. If you have medical issues, if you're on a diabetes medication, et cetera, you need to do it with the guidance of a physician who knows how to adjust things. Because the last thing I want to see happen is a diabetic who stops eating and then their blood sugar falls, and that's really dangerous.
Yeah, makes sense. So again, just consult with the doctor, and it probably not going to be your primary care doctor because they're probably not going to have the experience with long-term fasting. So someone like you, Dr. Josh, or someone else who has experience with these type of fasts. So,
Right.
so yeah, no, very, very cool. Yeah, I can't say I've done like a prolonged water fast. I mean, I've done like intermittent fasting and I've done 24-hour fasts, but are there concerns because you're not like with both the juice fast or a water fast, you're not getting protein, but is it, I guess, your justification like risk versus benefits? And again, it's not meant to be like a permanent diet and you're doing it for therapeutic purposes for whether it's metabolic disease or again, brain health.
Yeah, so that's a really great point. It turns out that the average American is not protein deficient today. It was different 100 years ago, but today, for most people, they're not protein deficient. So it really shouldn't be a concern if they're just drinking some juice or some water for a long period of time. Now, there are a few people who've had, say, gastric bypass or for some reason, mold toxicity, they can't absorb calories. And yeah, then and if they're already starting off protein deficient, no, I wouldn't recommend fasting in that scenario.
And then, so someone like when I dealt with Graves, I probably wasn't a good candidate because I was down to 140 pounds, lost a lot of weight. So again, that situation for people listening who have hyperthyroidism graves and they're losing a lot of weight, maybe not a good candidate. And again, I'm not asking for specific advice, but for Hashimoto's patients, have you had Hashimoto's patients do like prolonged fasting?
Oh yeah. And the exciting thing is, while they're fasting, often their symptoms go away. The tricky thing is when you start refeeding them. If you're giving them things like gluten or high inflammatory foods, the symptoms can come right back. So, but to me, the learning from that is that some of this inflammation is actually determined in the gut, because like why else? If you cut out the food, there's basically nothing in your gut to support your microbiome. So it's amazing how your microbiome in the gut determines so many different things, including the brain and hormones, etc.
Environmental toxins. So how big of a factor are, you mentioned mold, so there's mycotoxins from mold, but then there's so many other toxins and toxicants, microplastics and heavy metals and glyphosate, and we could go on, but
Sure.
I imagine those are also playing a role in the increased prevalence of dementia and Alzheimer's.
They are, and just to put a magnifying glass on a few of those areas, it turns out that many of the toxins you mentioned and that we're exposed to are fatty toxins, meaning once they get in your body, they like going to fatty tissues, not just around your belly or your bottom, but also the brain is extremely fatty, and even fattier is the myelin sheath that's responsible for nerve conduction. So it turns out that it's worrisome, these fatty toxins. Number two, plastics, as you mentioned. We're seeing higher and higher amounts of plastics in people's brains. We don't understand, especially with dementia and Alzheimer's, we don't know exactly how the plastics are getting into the brain and why they preferentially want to get or get into the brain. One theory is that there's something special about the nose and what's called the olfactory or first cranial nerve that goes from the nose back into the brain. So stay tuned. But for that reason, I strongly recommend people try to cut out as much plastic exposure, including clothes. Most of the clothes out there, unless it's organic, natural fabrics, it's made out of polyesters and other plastics.
Yeah.
And unfortunately, how long do we wear our clothes for? 10, 12 hours a day or longer. That's a perfect way to maximize exposure into your body. And then the plastics, some of them end up in your brain, which is not a good thing.
Yeah, those are good points. Just sometimes we overlook the basics, just like the clothing we wear, just wear 100% cotton and that would solve that. I know easier said than done when you already have your wardrobe and you might have to make some changes, but even if you just do those gradually and just from this point on, just try to buy cotton and not polyester, like you mentioned, that could make a big difference.
Agreed. Yeah.
Now, years ago, I don't hear as much these days, so I don't know if was more theory than what was in the research. But when talk about toxins, specifically heavy metals, there seemed to, at least in the past, they spoke about a relationship between aluminum and Alzheimer's. And again, I don't hear now. I hear more about. Honestly, I don't hear a lot about toxins, but now like the type 3 diabetes, that's more like blood sugar related. But is there that relationship, as far as you know, between heavy metals such as aluminum?
Yeah. So just terminology, aluminum on the periodic table is way at the top. It's a metal. It's not a heavy metal, but it's still super toxic to the brain. Specifically, we find aluminum in amyloid plaques, and it's where do people get aluminum from besides aluminum foil? Unfortunately, one of the large sources is drinking water. The very last step in most public water purification systems is to add aluminum to the water to remove the particulate matter like leaves and other things. So unfortunately, great, you got rid of the leaves, but now you put in a neurotoxin, aluminum. There's also aluminum in some vaccines and other things like that.
I did not know. So it's not considered a heavy metal, but just a regular metal. And,
Right.
I'll definitely trust.
I would call it a light metal like lithium.
Okay.
It's,
Yeah, but it's still, like you said, you just mentioned, it's
yeah.
still a neurotoxin. So even though it's not a heavy, so are all heavy metals like a health concern, or?
They are, but some are worse than others, right? Mercury and
Yeah.
arsenic are more concerning, but yeah, it's cadmium. Yeah, it's pretty scary.
Arsenic, is that considered a heavy metal then, or just a
Oh
regular?
yeah.
Okay,
Yeah.
okay. Just want to make sure, since I thought aluminum all along was a heavy metal, but
Okay.
again, since you have your two degrees in biochemistry, I'm definitely going to trust what you said. So, but
It's
yeah,
still toxic, well, regardless of where it is on the periodic table.
no, that's good to know. For those who are, I mean, we know, like, in order to prevent it, like a lot of the things that we already discussed, like incorporate those foundations, the diet, the stress management, making sure you're getting sufficient sleep and regular movement and exercise, reducing your toxic burden. When someone's dealing with more advanced case of dementia, Alzheimer's, I mean, they still need to do what we mentioned, but in that case, would you recommend for them to see a practitioner like yourself? Or, I mean, like, how much can they actually do on their own? And they're probably, like, I know in the case of, like, for example, my aunt, it would be, my cousins who would be taking care of her, and caretakers. So, the person who has the dementia, Alzheimer, wouldn't really be taking responsibility for their own health in that situation.
Right.
So I guess what kind of advice would you give for someone with more advanced case of dementia or Alzheimer's?
Yeah. So what I would advise is that get more than one opinion. And like I said at the beginning, unfortunately, many doctors out there will just say, "Oh, look, this is so advanced. Sure, we can start you on a medication like Aricept. It'll stop the descent downward a little bit, but there really is no hope." And I would say no. That look, because it's so advanced, that means we just need to work harder. But you need to find a doctor like myself who's willing to work harder, someone maybe with a functional experience who's willing to look at every strategy, not just a narrow, well, this is what the FDA says, so, or this is what the Alzheimer's Association recommends, so that's what I'm going to do.
Yeah, no, that makes sense. So that there is hope even in the advanced cases of Alzheimer. I know you mentioned kind of early when I asked, it's
Yeah.
possible to reverse it even in advanced cases, but I'm just coming back to that. It sounds like no matter what stage you're in, like you said, it'll take longer if someone has been dealing with it for many years, but no matter what stage they're in, there is hope.
Right. And just to be clear, many doctors won't even enroll people in studies if they're advanced. Like, oh, you're too far gone to even try a drug that will decrease inflammation or other therapies. And that's why I think it's important to get more than one opinion. Yeah.
Yeah, and what your approach too, I mean, obviously you want to do what you can to address the root causes, but you're also mentioning there's a time and place for medication, like the medication to reduce the inflammation. So again, and I agree with, when I dealt with Graves, I was able to avoid the anti-thyroid medication and took an herbal approach. But quite frankly, I work with people who need to take the anti-thyroid medication for whatever reason. And again, it's one of those risk versus benefits, and same thing with really any health condition.
Right. And it has to be personalized. So, for example, if you happen to have high levels of toxins, then often what we'll do is do something called total plasma exchange, where we'll filter the blood, remove the toxins in the blood, and then put human albumin in the other arm. So again, it's a personalized approach.
Interesting. Do you recommend any functional medicine testing, like stool panels? Like I mentioned earlier, like organic acids test, or like the toxins test, or do you assume just people have like a high toxic burden? And like, what's your approach when it comes to functional medicine testing?
Yeah, so I like doing them. And again, as I mentioned, they're expensive. But if someone's willing to do it with me, I'll not just test for heavy metals, but also test for infections, whether that's Lyme disease, herpes virus. Yeah, just as an aside, it turns out that if you have an active herpes infection, that will increase dramatically the amount of tau tangles in your brain. And tau tangles are one of the risk factors that we see in Alzheimer's. So I'll look at infection panels. I will look at forever chemicals, and like you mentioned, glyphosate or Roundup. And then I'll often do an advanced genetic panel, because it's not just ApoE or ApoE4. It turns out that there are many other mutations that will either decrease or increase your risk of getting Alzheimer's. But the cool thing is, depending where that mutation is, often there are medications or supplements that can be tailored directly to you based on your own unique genetic background. But there's only one way to do that, is that you actually have to have your genetic data first.
Okay. And that's a different type of genetic testing than what's out there, because there are other genetic panels?
So to be clear, it seems like most neurologists or primary care doctors are just testing for ApoE4 or ApoE. And I think that's important data, but it's ignoring, 100 plus other, important genetic mutations that will affect your risk for getting dementia.
Okay. So you do like a comprehensive genetic test that looks at those risk factors, but then also, I know the other, like they also look at genetic variations related to detoxification, for example. And so you're doing a comprehensive genetic panel, I guess is what I'm getting. Not
exactly, for the patients who are willing to do it. And there's an expense, but yes.
And so you mentioned herpes being a risk factor, and you talk about herpes simplex then?
Yeah, herpes simplex, herpes complex, specifically an active herpes infection, whether you've got a cold sore, or sometimes people can have a herpes infection in their brain and not realize it, or other parts in the body. And these herpes viruses, or even chickenpox, they're tricky. They can hide in nerve cells and only come out to play when your own immune system gets shut down.
Yeah. How about because Epstein-Barr and cytomegalovirus, they're like members of the herpes, so that they as well can also be a problem?
Exactly right. And it's a similar type thing. Most people already have exposure to those viruses, and they're latent, they're hiding in nerve cells throughout your body, but they normally don't come out to play unless and until your own immune system has trouble working. So when your immune system can't keep these viruses under control, then they're like, hey, the coast is clear, time to play, time to spread and to multiply.
All right, that makes sense. And Lyme and Bartonella, I know you mentioned briefly Lyme, so those also could be potential factors too?
True. And, sometimes we find Lyme present within Lewy body for people with Lewy body dementia. So it is my belief, again, I can't prove it unless we do autopsies, but it's my belief that infections are one of the important causes, these up to 200 root causes that I talked about at the beginning.
All right. Well, we covered a lot. Is there anything else that I a lot of times I'll ask, is there anything I didn't ask you that I should have asked you? But I asked you a lot of questions, but I'll still ask you, is there anything that I didn't ask you that I should have, or anything else that you'd like to cover before we start wrapping this up?
Sure. So I would say, in terms of the hope, we have many other treatments besides decreasing the inflammation or getting rid of toxins. We also have IV therapies, light therapy, oxygen therapy, many different therapies. It's not because we're dealing with more than one process. Normally it's a gradation, and it's like a concert or orchestra. You put it all together. So, I understand people out there are hearing this one supplement or this one magic thing will help. And no, normally it's not just one thing. So, for example, omega-3s, yes, I definitely recommend people with dementia supplement omega-3s. Even I like algae oil up to 3 grams. I also like lion's mane. You can find on my website some of my favorites, but the key thing is normally it's not going to be just one thing. And that's what you hear often. People are just trying to promote their one supplement, and no, that's not normally going to be enough.
Yeah, no, that makes sense. And you mentioned oxygen. Were you referring to like hyperbaric oxygen, or?
Yes, hyperbaric oxygen. You could also use ozone to bust up biofilm if that's present in the brain. And sometimes we use nanobubbles, basically really small oxygen bubbles that will get in through the skin if we put your feet in the nanobubbles, or basically have like a bathtub type situation. So oxygen's your friend. Another thing that's been really helpful is exercising with oxygen. There's something about that seems to strengthen and release something called BDNF, brain-derived neurotrophic growth factor. And what BDNF does is it establishes new neurons and neural connections, synapses. So yeah, I would say don't stop at just one or two therapies or options.
All right. No, thank you for that advice. And yeah, thank you for this conversation. This was awesome. And where can people find out more about you, Dr. Josh?
Yeah, it's easy. You can probably easiest is just drjosh.com, drjosh.com. And my email address is just drjosh, drjosh at drjosh.com. I'm on social media under Green Brains MD, but probably easiest to find me at drjosh.com. And I've got a weekly podcast on reversing Alzheimer's. So if you want to hear a lot more of, actually not so much me, but lots of other experts on this topic, that's a good place to go.
All right, awesome. Well, of course, we'll put those links in the show notes. And yeah, this, like I said, this was awesome. I'm glad that we had this conversation. Definitely check out Dr. Josh's website, his podcast. I mean, if anybody listening knows someone dealing with dementia or Alzheimer's, again, feel free to reach out to Dr. Josh as well to schedule a consultation. But one other thing, do you? I imagine for like something like this, would they have to come like in person? Is that like, do you do telemedicine or how does this work?
Yeah, I do telemedicine. Obviously, there's some procedures like filtering someone's blood with total plasma exchange, kind of have to do that in person. But yeah, no, I have many clients in the States I'm licensed in or coaching using telemedicine. So that's powerful. And what I tell people, I'm not looking to replace anyone else's doctor, but I am here to provide help and hope, because unfortunately, as I mentioned, this information really hasn't gone out yet. And that's why I'm grateful, Dr. Eric, that you're willing to host me today.
Yeah, it was a pleasure. It was, again, wonderful having this conversation. I'm sure many of the listeners will find it to be beneficial. And again, I learned, if you didn't catch on, I learned some things as well. So yeah, thank you. Thank you so much, Josh. Appreciate you having you on. And yeah, definitely looking forward to spreading the word and sharing this episode with my followers.
Awesome. Peace and plants.